Breastfeeding is a tremendous bonding opportunity for new moms and their babies, and there's also many physical and mental health benefits as well. And here today to discuss the many benefits of breastfeeding is Holly Shannon. She's a registered nurse and the Lactation Program Supervisor with SVMH. This is Ask the Experts, a podcast from Salinas Valley Memorial Healthcare System. I'm Scott Webb. Holly, thanks so much for joining me today. I know you've been at this a long time, right? And I know you teach classes, and it's such a great topic, breastfeeding. And I also know that Salinas Valley Memorial Hospital is a baby-friendly designated facility. What does that mean exactly? What is baby-friendly, and why is that important?
Well, baby-friendly is very important. It was actually established by the World Health Organization and UNICEF in 1991, and they came together to encourage breastfeeding throughout the world. And their goals were to inform mothers of the benefits of breast milk and to remove commercial interests from hospitals. To receive the baby-friendly hospital designation, hospitals and birthing centers must meet 10 different criteria, including staff training, educating mothers about breastfeeding, and allowing infants to room in with their mothers 24 hours a day. Baby-friendly assists hospitals in giving mothers the information, confidence, and skills necessary to successfully initiate and continue breastfeeding their babies. But in cases where patients have a medical indication or have made the informed decision to use formula, we provide information about safe preparation and feeding of formula to these moms. And Salinas Valley Memorial Healthcare System is super proud to be one of only 595 baby-friendly designated facilities in the United States. So it's a really big thing, and we're really proud of our designation.
Yeah, it is a really big thing. That's a great way to put that. So let's talk about this. We're going to go through, you mentioned formula versus breastfeeding and so on. And my kids are older, but I do remember having these conversations about them with my wife, and give you the really important one here up front. Why do you believe it's so important to breastfeed?
Well, breastfeeding or human breast milk is species specific. It is the perfect food for most infants. It provides so many benefits for babies, for mothers, actually for the environment, for our society, for employers. A few of the benefits for babies are it develops a stronger immune system, protection against asthma, obesity, diabetes, ear infections, respiratory infections, species specific, so it's very easily digested by babies. It's been linked with better vision, higher IQs, and better behavior as adolescents and in school. So it's obviously the perfect food for most babies. For moms, there are also many benefits. It can help lower her risk of hypertension, type 2 diabetes, postpartum depression, and even different cancers, including breast, uterine, cervical, and ovarian. So it's really important. It's free. It saves.
That's a great way to put that. It is. It's free. Yeah.
Formula is expensive. On average, it costs $1,200 to $1,800 a year, depending on the brand. It's about $5 to $6 a day to formula feed a baby, whereas breastfeeding is free. It's always available. It does not carry the risk of contamination, shortage, or need special warming, handling, or equipment. So it's the easiest way to feed a baby.
Yeah, absolutely. You mentioned about infections and protecting against infections. Obviously, babies can't be immunized, right? Not for a while anyway. So that breast milk and the breastfeeding is so important. And I'm wondering, how soon after a baby is born can breastfeeding begin? How often do babies need to be breastfed, and so on?
So ideally, babies should breastfeed within the first hour of being born. Here at SVMH, for our healthy term infants, we place them skin to skin as soon as possible after they're born, and we help them with breastfeeding. Most newborns eat about 8 to 12 times in 24 hours. So we recommend cue-based feeding, which means that we teach moms how to identify feeding cues, and we encourage them to breastfeed their babies when their babies are showing these feeding cues.
Yeah, and for all of us parents in the group, we know what those cues can often be. Sometimes you get those cues at 3 o'clock in the morning and you know exactly what the baby wants. And we have touched a little bit here about formula, and there may be times where that's the only option or the best option despite the cost and so on. So can babies get the same nutrients with formula? Can you give formula and breast milk? Can you kind of mix the two? How's that work?
I don't think you need to be black and white, either breastfeed or formula feed. Any amount of breast milk or breastfeeding is beneficial for the baby. And whether it's one feeding a day or, for 2 weeks or 2 months or however much breast milk a mother can give her baby is going to be beneficial. Now, formula is different than breast milk. Both breast milk and formula provide energy, hydration, nutrients, but breast milk does provide a lot more than formula. Store-bought formula tends to be made from processed skimmed cow's milk with added nutrients, vitamins, minerals. They add sugars and oils. And so it isn't exactly the same as breast milk, but they certainly try to make the product as similar as they can. Breast milk just has so much more protective qualities, the antibodies and hormones and stem cells and white blood cells and the good bacteria that, isn't present with formula.
I mentioned up front there about you being a teacher and the different services offered. So what programs does SVMHS have for expecting moms, lactation services before, after birth, and so on?
So we have inpatient and outpatient lactation services. We offer childbirth education courses prenatally, and we offer breastfeeding classes prenatally. And so we see patients throughout the hospital who are lactating and patients from all over the community, whether or not they deliver here at SVMH, can come in and see us in our outpatient lactation clinic.
Yeah, and if a mom is having difficulty producing milk, what do you recommend that she does? What type of support is available? And especially the emotional support.
New moms need support. We're one of the only societies who really expects moms to do it on their own. And I really, really believe that it takes a village to support the baby and the mom, this couplet. And so for a woman who's struggling with her milk supply, the first thing I would recommend is that she seek out a lactation consultant to help her. What we're going to do is we're going to determine kind of what's going on, get some history. Is it that the baby's been sleepy? Is it something with mom? We're going to try to figure out what the root cause of her milk supply issue. And then we're going to set up a plan to help her make more milk and hopefully meet her feeding goals. And so I think the most important thing would be for her to contact that specialist to kind of help her set up the plan so she can eventually be successful.
Yeah, and does kind of a follow-up here, does SVMH have donated breast milk for moms? I hadn't heard of that, but I was kind of reading through here. I just want to verify, do you have donated breast milk for moms who cannot produce their own?
We do use donated breast milk in our NICU.
Awesome.
Yeah.
Along those lines, then, do you provide pumps? Are they free or maybe a low charge to low-income moms?
So pumps are considered medical devices. And through the Affordable Care Act, insurance companies will provide a breast pump for their patients or our patients. And so we do help moms in obtaining a pump. We do not give away pumps here. And so what we do is we refer them to their insurance provider. If a mom is low income, she may be a WIC participant. We give our moms information about WIC, and WIC can provide a hospital-grade pump as a loaner, or they can help her obtain a pump through her insurance, whether it be private insurance or Medi-Cal. And so we do help the moms in getting a good quality pump for home use. We have hand pumps here that we can give any mom who wants one, but we really recommend that she get a very good quality double electric pump, and her insurance will help her cover that cost. We have hospital-grade pumps here at the hospital that we'll set up for our moms, but those are for inpatient or if her baby is in the NICU.
This has been really educational and fun. I'm sure it has been for listeners as well. And I'm also sure that there's a lot of resources out there. So wondering if you can share at the end here, where can an expecting mom go or a number they can call for more information about lactation services, anything else?
Absolutely. So they can call our lactation department directly at area code 831-759-3060, or they can access information, our classes, our phone number, contact information through the SVMH website as well. And so if someone leaves a message, we'll call them back as soon as possible. We do have lactation specialists 7 days a week here, and we see outpatients 5 days a week by appointment.
That's perfect, Holly. It's been really a pleasure to have you on today and learn more about this. Thanks so much. You stay well.
Thank you so much. It was nice talking to you.
For more information on all the services and specialties Salinas Valley Memorial Healthcare System offers, please visit our website at svmh.com. And if you found this podcast to be helpful, please be sure to tell a friend, neighbor, or family member and subscribe, rate, and review this podcast. And check out the entire podcast library for additional topics of interest. This is Ask the Experts from Salinas Valley Memorial Healthcare System. I'm Scott Webb. Stay well, and we'll talk again next time.